I'd like to call the January 5th, 2021 meeting of the HHS DuPage County Committee to order. It is what, 9:32, 9:33, right there. We do not, let's see, do we have, well, we're going to say we don't have a physical quorum.
We have 4 in the room.
I'm not on your
committee.
committee.
Oh, you're not.
I'm just hanging out.
I'm saying the whole time, we checked ahead of time. So technically, we have no physical quorum present. Section 70 of the Open Meetings Act permits members to attend remotely. For the record, we do have a member, officer, or counsel physically present at the regular meeting location. In-person attendance and public comments are allowed, subject to attendance limitations to ensure the health and safety of those who attend. So basically what that means is all votes will be roll call votes. Roll call, please.
Chair Renahan,
Here.
Member Schwarzy,
Here.
Member Chaplin,
Here.
Member Dessart,
Here.
Member LaPlante,
Here.
Member Solomon.
Here.
And I am informed we do have a couple public comments.
We do. William will read them all. We'll read them.
On December 22nd, 2020, Carrie B. wrote, I want to make a plea to the board to please consider changing the metrics when it comes to COVID-19. Many school districts are using your metrics as a reason to not open schools. Children need to be in school. Them not being in school is hurting them emotionally and physically because they spend hours in front of games and TV. I am having trouble understanding when money became more important than our kids, but that seems to be the case. I know that funeral homes and hospitals get more relief money for more COVID cases they get. Everyone is struggling and money is tight for a lot right now, but it is hurting our children, and yet it just keeps happening. It's like they just don't matter. They are not spreading the virus. They are just being kids, and kids are vulnerable. Over the past month, I've learned of 3 suicides in kids. Do kids' lives not matter? Suicide can be contagious, and with the winter months coming up, you don't know how out of control it may get. You have the power to fix this for the kids. Please consider doing so. Thank you. On December 22nd, 2020, Kelly A. from Elmhurst wrote, please consider the long-term social, emotional, and educational impact on children being out of school for this extended period of time and make a recommendation for schools to reopen. It has been shown through many of the private schools that have remained open that COVID transmission is nearly non-existent within the schools where masks are worn and plexiglass partitions are utilized. My youngest daughter has been in school kindergarten since August with no COVID-related issues. My older 2 children are still home learning remotely. And those are all public comments.
All right, thank you. And with that, I will move to chairman's remarks. I do have some opening remarks for our first meeting here. First of all, Happy New Year to all, and I hope it is a healthy and safer new year for all of us in DuPage County. I'd like to introduce my co-chair, Greg Schwarzy, over here. Greg is new to the board, but he is no stranger to government, and I look forward to working with you the next couple of years. Thanks to our amazingly dedicated staff, Mary Keating, Community Services Director, Janelle Chadwick, DuPage Care Center Administrator, and Barbara Hyde, also from the Care Center, our Administrator, Karen Graycheck, and our Assistant State's Attorney you just heard from, William. So I'd also like to welcome our brand new members, Selman, Chaplin, and LaPlante. Welcome to HHS. So on this committee, most of the agenda is going to revolve around community services and development and the Care Center, but you will see some Veterans Affairs occasionally. I've asked Karen to provide you with a community services flow chart, and in normal times we would go around and introduce whoever's more so in the room and who's here, but for obvious reasons we're kind of stilted in that respect. We will have ongoing presentations to highlight services so members and the public can become well versed in the vast services the county provides and works with the partners to partner to better lives of residents. I would also advise you to take a look at the online presence of DuPageCRIS.org to get a feel for the breadth and scope of some of the things that we do on this committee. In addition to ongoing programs, we will continue administering grants for critical needs and demands as a result of COVID. And Mary Keating will speak later during the meeting regarding CARES Act funding that comes through community services that lies outside of general county allocation. I just wanted to mention we had some public comment regarding schools. As we've heard many times from our Board of Health Chairman Tornatori, this committee does not have jurisdiction over the health department. Although I think we should later on have some discussion whether we want to change, whether this committee would recommend changing the name when we discuss the Rules Committee, maybe possibly taking health off of it so as not to confuse the public. But that's a discussion for later. Housekeeping, if you can just say your name if you're online in particular, so Karen can record appropriately. And with that, I will take a motion to approve the minutes of Tuesday, December 1st, 2020.
So move Chaplin.
Second.
Second, Shorzy. And any comments, additions? Roll call vote, please.
Member Chaplin?
Aye.
Member Desart?
Aye.
Member LaPlante?
Aye.
Member Schwarzy?
Aye.
Member Selman?
Aye.
Chair Runningham.
Hi. Our first point of business is we have a length of service award. Shatanya Herring, 15 years. And to present that, we have Mary Keating and Natasha Belli on line.
Well, first thing I want to note is not only have we been joined by Shatanya and Natasha, but basically the entire management team of the senior services division. I think it's a testament to not only what a strong and supportive team they are, but how much they all respect and admire Shatanya. So thank you to all the seniors managers who have joined us this morning, in case you were wondering who all these extra people were up on the screen. It's an absolute honor and a pleasure to be able to work with Shatanya Herring and have an opportunity to have her recognized in front of this committee. Shatanya manages the Adult Protective Services Unit, which investigates allegations of abuse and neglect against seniors and persons with disabilities living in residential settings. She is absolutely known throughout the state as an expert, not only on the legal and social service nuances of doing that difficult work, but also just for her passion, her commitment to the field. She's done trainings across the state. She is absolutely, without a doubt, one of the finest employees who is out there representing DuPage County. I'm sure Natasha wants to say a few words, but like I said, I couldn't be more honored to work with somebody like Shatanya, and I think the board needs to really be aware of what an incredibly high quality person you have out there representing you. So Natasha?
Thanks, Mary. And I just want to, I agree with everything that Mary said. Shatanya has been with us now for 15 years. I've known her the whole time since I started here at the county. And so I just kind of want to thank her for her service and for joining our team 15 years ago. You make my job extremely easy. And I know if I have a question that has to do with elder abuse or something comes up, all I have to do is pick up the phone and you can give me the answer right away. So thank you so much for your dedication and your service here at DuPage County. I'm really proud of the manager that you've become over the last couple of years. So thank you.
Shatanya, it's your turn.
Oh, and I do have your certificate here with me, so I'm holding it hostage for you. So I'll give this back to you at some point.
Thank you so much, everyone. I am so surprised to see all the faces. I was like, oh, they must attend this all the time. So thank you, all the managers and administrators that are here on this call with attending this meeting. And now I'm like, I should have invited my staff so they remember that I could be good sometimes, because we've been lately, I think they feel like that, we're all just crazed these days. Yeah, we're very busy here at in Adult Protective Services, but I really do, appreciate, just all the support I receive from both Mary Keating and Natasha Belli and all of my colleagues that are here on this call today. We as a community services department, we are all compassionate about the people that we serve. Since I was a little girl, I've always been an advocate. It's something that's in my blood. Sometimes I can, I guess it's been a blessing. I guess sometimes I wonder if it can be a curse at times because I get too compassionate. But, I really do care about what happens, to our seniors and people with disabilities. So I'm very honored to do this job and have a team that also cares about this line of work as well. We're out here doing everything we can to protect our seniors and people with disabilities. And again, without the support of our director, Mary Keating, and our administrator, Natasha Belli, and all my great, fabulous co-workers, who support me on a daily basis, even after hours, I appreciate everyone. And again, thank you. It's been an honor to be here at the county for 15 years.
Yay. Great. Well, I want to say on behalf of the committee, Shatanya, congratulations. And, what a testament to community services, to DuPage County that, you're willing to serve 15 years. And I know this has been a particularly, an area that's been, taken a lot more on in the past years. You see much more elder abuse, much more disability abuse. I thank you for all you do. So we'll be watching what you do next, right? In these next years or so. All right, thank you. With that, we have 2 community services items. We're going to take them separately. We just have 2. I request a motion to approve FIR 55-21, resolution of acceptance and appropriation of funding NICOR gas saver project grant, $3,000.
So moved to start.
Second.
Questions, comments? Roll call, please.
Okay, we'll go with Member Desart.
Aye.
Okay. Member LaPlante.
Aye.
Member Swarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Chair Renahan.
Aye. That is approved. Also request a motion to approve FIR 56-21, acceptance appropriation of retrofits program, County Unit 1555, $286,200.
So moved.
So moved. Second to start.
Questions or comments? Roll call, please.
Member Swarzy.
Aye.
Member Selman.
Aye.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
And Chair Renahan.
Aye. And that is approved. Moving to 8, Community Development Commission. I will entertain a motion to approve FIR 57-21, acceptance and appropriation of additional funding in time for emergency solutions grant. An increase of, let's see, from $1,031,548 to $3,515,152.
So moved, Chaplin.
Second.
Second.
Thank you, Member Schwarzy. Any questions or comments? A roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Swarzy.
Aye.
Member Selman.
Aye.
And Chair Renahan.
Aye. That is approved. I'll entertain a motion to approve HHSR 58-21. It's a resolution to reduce the affordability from 40 to 15 years for the PADS project.
So moved to start.
Second, Chaplin.
Questions or comments?
I just was going to ask Mary to explain this.
Sure, yeah, in fact, you're not the only committee member who asked questions about this. When we receive funds from HUD for the Home Affordable Housing Partner Program, when we allocate those funds to a project, we are required to do something called a period of affordability, which is basically a period of time under which we are responsible for monitoring the project for its compliance with federal regulations. Back in the day, we used to extend it well beyond the federal requirement. But over time, for a couple of reasons, we've made the determination that it's really in the best interest of the county to stick to the federal timeframe. There's really 2 primary reasons for that. The first is whatever we set as the affordability period, we as a staff have to physically monitor that project annually. Means we have to look at the rent rolls, we have to inspect the units, we have to income document the tenants who are there, we have to review their leases for the language. It's a significant administrative burden. The home funds have been cut significantly since the time that we initiated these projects by a factor of about 50%. And of course, our staffing costs, so the cost of monitoring has gone up as the resources for monitoring have gone significantly down. The other reason is that by going with the federally mandated affordability period, we're reducing the risk to the county of having to pay back those home funds from general funds. Hypothetically speaking, if 38 years into this project, PADS was out of compliance, we would then be out of compliance with federal regulations. And even though we were far exceeding the federal requirement, we would be basically in default of the agreement that we had set up. And so while we would certainly be going after PADS or whatever nonprofit entity to recoup those funds. First and foremost, HUD would be coming and US Treasury would be coming to us to repay those funds out of general funds. So those are the primary reasons. We started this process probably about 5 years ago, just kind of going through all of our home projects and getting them and shortening those affordability periods. If this project were being initiated today, the affordability period would be 15 years. Does that explain it?
It does. Does doing this put any of potential residents at risk?
No, basically it's just saying you know, when you're working with when we work with well-established, well-run nonprofit organizations, we do have a high level of confidence that they will continue to provide, to utilize this property for permanent supportive housing.
And DuPage PADS
DuPage PADS
they've been
is
doing a good job.
Oh, yeah.
For 15 years.
Oh, yeah. Yeah.
Okay,
We've never had any compliance issues.
thank you.
Member Desart, did you have a question?
I do. Thank you, Madam Chair. Everything, Mary, that you just said makes perfect sense, absolute sense. So I'm wondering about historically, why did the county go longer than the federally mandated time period?
Well, this program initiated in the early 80s, and I think it was most likely the thought at the time that the county was growing like crazy, and so we need to make sure that we're putting like these massive restrictions on anything that we're investing for affordable housing. Also, I think we were mirroring so many of the projects that we do, this is not one of them, many of the projects that we do in conjunction with IDA, the Illinois Housing Development Authority. IDA tax credit program has a 40-year compliance period. So I wasn't here back then. I could have been, I was out of college by then, but I think that the idea was let's mirror the tax credit program and let's really extend this out. But I think it really wasn't until somewhere in the 5 to 10 year look back now that we came to realize that, wait a minute, with these extended periods, we're just extending our monitoring requirements and the risk to the county of payback. So, all right.
Excellent. Thank you. Thank you, Mary.
Any other questions or comments from the committee?
Great, thanks.
Roll call, please.
Member Desart,
Aye.
Member LaPlante,
Aye.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
Chair Renahan.
Aye. And that is approved. Moving on to the Care Center, Janelle Chadwick. I have a motion to combine and approve items 9A, B, and C. They're all contract purchase orders and one change order for Care Center supplies and equipment.
So moved, Chaplin.
Desart.
Second, Chaplin.
Okay, any questions, comments on these items? A roll call, please.
Member Desart,
Aye.
Member LaPlante,
Aye.
Member Schwarzy,
Aye.
Member Selman,
Aye.
Member Chaplin,
Aye.
and Chair Renahan.
Aye, approved. Budget transfers, I have a motion to approve budget transfers at $392,352 to allow sufficient funds to post payroll for DuPage Care Center.
So moved, Chaplin.
Second, Desart.
Thank you. Questions, comments? Roll call?
I do have a
Oh, I'm
question.
sorry, Member Schwarzy?
And I had this question with JPS as well. So this is for last year's budget, I'm assuming.
That's correct.
Oh, sorry.
I'll come up here. Yes, this is for the fiscal year 20 budget.
Okay.
So a lot of the departments, they go over on a line item, and county board rules and finance policies say that they shouldn't be over budget in a line item. So we shore that up at the end of the year. There's money available within the budget. We'll do these budget transfers. So this right now is really house cleaning.
Sure.
And in our financial statements, we'll have our original budget for each of the departments. And then with all these budget transfers that happen during the year, you'll see in the financial statements an amended budget. Sure. So that's kind of how we do it.
Is it normal, because we're in the beginning of month 2 of the new fiscal year, is this a normal time period to do that housekeeping versus say a month ago, or?
Well, we have invoices and accrued payroll that come in now. at the end of our fiscal year.
Gotcha.
So as that comes in, the departments look at their financial statements and say, I gotta make this adjustment. These should slow down a little bit, but they do happen throughout the year as things come up within the departments. They may not have budgeted for something, or something will go over, so they use money from another line item to cover that. As long as their entire department doesn't go over budget, then they're okay with these budget transfers. If they go over budget, they need an additional appropriation ordinance or resolution.
Thank you very much.
Thank you.
Thank you,
And
Jim.
this is, I have just a couple additional comments. These were actually just realigning payroll to payroll lines where the cost incurred. So it wasn't even pulling from other departments necessarily. It's just pulling payroll and putting it under the expense line where the expense incurred.
Thank you.
So it's within budget, not in addition. When I started about 3.5 years ago, we used to do budget transfers all at the end of the year, and it would be significant. And working with Christine Claybon, who's also on here, we revised that process to do them throughout the year. So we have much fewer that occur at the end of the year. I think it was just more of an accountability on our part and to really watch and monitor our expense side. So that's really helped us a lot by making that change.
Thank you, Janelle.
Okay, if we don't have any more questions or comments, roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Chair Runningham.
Aye. Approved, and we have one motion, if I can get a motion to receive and place on file informational item grant proposal notification, $286,000.
So moved, Chaplin.
Second.
Questions, comments? A roll call, please.
Member Chaplin.
Aye.
Member Desart.
Aye.
Member LaPlante.
Aye.
Member Schwarzy.
Aye.
Member Selman.
Aye.
Chair Runningham.
Aye. That is approved. I do not have any residency waivers, is that correct?
Correct.
Okay. And then finally, we get to the overview of non-CRF CARES Act funding. Talk fast, Mary Keating.
Yeah, do I have 5 minutes or do I have till 10:15?
I think 10:15 is the next
Okay,
one.
all right. Can I ask, should we do Care Center first? So that we make sure that Janelle has an opportunity to give her updates and then I can get through my
All right,
presentation.
great idea. Great idea. Yeah, Janelle?
You're so kind. Thank you so much. I'm going to go quick. For new board members, welcome. I'm going to run through some numbers really quickly. So if you have questions, you can certainly reach out. So the Care Center does our own COVID tests here on site. And in the last 10 months, we've conducted over 20,000 COVID tests of our staff and residents. We were doing staff right now at a rate of about 2 times per week. Residents is running around that same, just based on potential exposure. We currently have 5 of our 8 units under quarantine due to a potential exposure. Since April, which is 10 months now, we've had 93 staff members and 80 residents that have tested positive. Our cases have slowed down quite a bit. Our last resident case was December 20th, so we're very optimistic. I'm not wearing scrubs today. That's me optimistic. We're going to get back to regular clothes here. So we are using CVS Omnicare as our vaccination administrator. We've been in contact with them. We do not have a clinic date yet. I've all but harassed the man over the holidays to figure out when we can get this set. So working on that. We did receive the consent forms that we have to complete for every single inoculation. It's a 2-page triplicate form. So certainly not user-friendly. We've had to put together an entire task force on how to get these completed for all of our staff and residents. You're also gathering copies of all insurance cards. Obviously, if a resident can make their own decisions, they're making that decision on the vaccination. But other than outside of that, then their resident's representative would be making that decision. So we have to do communication blasts in different formats to communicate the vaccination process here at the Care Center to all of our representatives. On a different note, any questions on that piece before I have one other area? I know vaccinations is a big question for everyone. Then the last part I'm going to talk about is we have a new medical director here at the Care Center, Dr. Mealy. He's been with us, but our prior medical director retired. So we're very excited to have Dr. Mealy on board. We've also added another Northwestern physician, and then we are adding a DMG physician as well. It helps with continuity of care and physician oversight. We've entered into a new contract with Aetna. We're pursuing Humana and United Healthcare. We're working with ILASM, which is our non-for-profit state association network contract branch. And they've been very helpful in getting us included in a volume-based contract. So even though we're in the middle of a pandemic, we're still moving forward with a lot of strategy. Our admissions, we just started looking at taking admissions again. So we went without about 10 months with really only taking a handful of admissions just based on our outbreak status, which is a regulated issue. So we are very excited that we're going to start ramping back up again. So that's the report for the Care Center.
Thank you, Janelle, and thanks for all you do. I think we're all very impressed with, you know, how you're handling things and taking care of our seniors over there at the Care Center.
Thank you.
And with that, we will move to Mary Keating, Community Services.
Madam Chair,
Yes, oh, I'm sorry, I didn't see you there.
no, I just wanted to let you know that I'm popping out of this meeting to head over to transportation. So thank you all.
Yes, perfect, thank you.
Okay, thank you. So I thought it would be helpful, you can go to the next slide. I thought it would be helpful, and at the request of Chair Renahan, to give an overview of the non-coronavirus relief CARES Act funding that is coming through the Department of Community Services. First, I just kind of wanted to, you may have noticed that I'm extremely intentional when I'm talking about CARES Act or coronavirus relief funds. So when we're talking about the $161 million that the county is administering, that's CRF funds. The CARES Act was the entire piece of legislation that was passed in March of 2020. It's that $2 trillion stimulus package. I'm going to talk about three sources of allocations from the CARES Act, all of which eventually trickle down to the Department of Community Services. So the first on the left is the one you're most likely most familiar with. The U.S. Treasury was allocated $150 billion for the Coronavirus Relief Fund, which was given to units of government with populations over 500,000. By virtue of that allocation, DuPage County got $161 million, and the board then authorized $7 million of that to be allocated to the Department of Community Services. What we did with those funds were we assisted food pantries, we provided rent assistance, and we provided a reimbursement of expenses for nonprofit organizations for things like PPE and technology, as well as staffing for residential and behavioral health services. So those are the funds that the board has been talking about now for basically since March of last year. There's two other pots that I think are important to talk about. So through the U.S. Department of Health and Human Services, a program called the Community Services Block Grant was provided $1 billion. And I do want to say all of these funds are above and beyond what sort of the normal annual appropriations are. So CSBG program was allocated $1 billion. That came to the state of Illinois. 43.5 million of that came to the state of Illinois. The state of Illinois then turned around and gave 1.5 million to DuPage County by virtue of our status as something called a community action agency. So not every county in the state gets CSBG funds. There's only a few of us who serve as community action agencies. So we got 1.5 million from the CSBG program. And then the programs that went through the U.S. Department of Housing and Urban Development, or HUD, there were two CARES Act appropriations. The first, the Community Development Block Grant Program, was given an additional $5 billion beyond annual appropriation. Because we're what's called an entitlement community, meaning our population is large enough that we get our own CDBG money, we received $6.7 million in additional CDBG money. And then on the Emergency Solutions Grant, which is typically a much smaller grant program, we actually are ending up with two allocations of ESG. The first, because we are an entitlement county, meaning where our population is large enough to get our own appropriation, we got $3.5 million in ESG funding, and that was one of the things that was on your agenda today because it came in two pots. And then again, Illinois received 42.9 million, and because of our affiliation with the DuPage County Homeless Continuum of Care, we got $654,000. So basically, you can go to the next slide. What I want to talk about is all of the additional funding that we're getting outside of the coronavirus relief fund. So here you see the exact dollar amounts for those additional appropriations that I was talking about. So all told, we're at $12.3 million in additional funding for the Department of Community Services. Just to put that in some context, the entire department on an annual basis, our budget is about, it varies from year to year because we're grant funded, so things can vary. Our entire department budget is about 25 million. So we're talking about a 50% increase in funds that we will be managing primarily in 2021, but also in some level into 2022. The purpose for each of what we can do with these funds, clearly all of them have to tie directly to COVID response and recovery. So that's sort of the overarching of everything related to the CARES Act. But beyond that, there are more specific guidelines for each of these funds. So for example, the CDBG program can be used for capital funds. It's really the only one of these that can be used for capital. And it has to benefit low and moderate income people. So there has to be some sort of documentation that the folks who are receiving services or the building that you're acquiring or rehabbing is serving low and moderate income persons. The CSBG program can provide basic needs, but folks have to be below 200% of poverty. The ESG funding has to be used for either emergency shelter or homeless prevention and rapid rehousing. It can be used for case management, things like legal services that get tied into homeless prevention as well. And then the one that actually came through the state is a little bit more narrow because of the way that the state gave it to us, can only be used for homeless prevention and rapid rehousing. Basically what that means is rental assistance. So the status of each of these, the CDBG program, we're actually at the CDC Executive Committee meeting later this morning. We'll be talking about our plan to solicit the first round of applications for 1.5 million of those CDBG funds with a narrowly defined eligibility of food assistance and housing. Again, that's pending approval by the CDC Executive Committee. If that's approved, we'll be going out very shortly to solicit applications from nonprofit entities seeking to access some of those funds. That's sort of our first take at how we're going to use CDBG. We'll be looking further down the road at the possibility of capital funding. But first and foremost, we want to get those public services out the door. CSBG, we are already in process of providing contracts for organizations like PADS, Catholic Charities, Metropolitan Family Services for hotel stays. We have funds for rental assistance that are available both through us and through some of our community partners. And we're also providing additional assistance for the food pantries. For ESG, we have already allocated that first appropriation of roughly $1 million, primarily for hotel stays. Again, PADS, Catholic Charities, Metropolitan Family Services. And we're currently soliciting applications for agencies that want to administer homeless prevention funds. And then our ESG that's coming to us through the state is all being managed in-house by our Housing Supports and Self-Sufficiency Unit. Case managers there, when they're working with clients, they look to see if the ESG funds are an appropriate use of assistance for those clients if they are eligible. And ESG has some other eligibility requirements that just are way too far in the weeds to try and get into. So that's what we know about the funds that we're getting. There's also this enormous tsunami of rental assistance that we're just learning more about. So the most recent relief bill that was passed in December has $25 billion for emergency rental assistance. What we know about it is that communities, similar to the coronavirus relief funds, communities over a certain population are eligible for a direct allocation. So CRF, it was communities over 500,000. They've lowered that threshold for this program. So it's cities and counties of over 200,000 population are eligible for a direct allocation. The funds have to be used for rental households under 80% of area median. that have a financial hardship due to COVID and are at risk of homelessness due to past rent or unsafe living conditions or other risk factors. The legislation said that the priorities need to be placed on households below 50% of AMI and households with someone who's been long-term unemployed. The regulations also say, or I should say the legislation, the regulations haven't been issued. The legislation identifies households can get up to 12 months of assistance, but they need to sort of recertify every 90 days that they have a continuing need. The real kicker here is 65% of the funds have to be spent by September. So I put September 20th to September 30th. So we're already in the almost second week of January. We don't know, I'll get to the next about what we don't know, but having to spend 65% by September could be a real challenge. I guess the good news is 10% is available for administration, so we will be able to charge staff time, or if we end up contracting with outside agencies, we'll be able to provide, we'll be able to pay for that. Can you go to the next slide?
Could I ask a question,
Yeah.
Chair Ryan? On the last slide, when we're looking at how it's calculated based on income, is that based on previous years, like tax returns, the way the stimulus checks have been, or is it based on like current pay slips or whatever income they currently
I
have?
believe what the legislation says, you can do it two ways. You can do it either based on the last 30 days, most recent 30 days of income, or the entirety of what they've earned in 2020.
Okay, yeah, I just want to make sure, because it's been a frustration I've expressed to many, that what people made in 2019 means nothing
Right.
for what they made in 2020. So great,
Yeah.
thank you for that clarification.
The legislation does address that.
Perfect, thank you so much.
Okay, so here's the biggest question that we don't know. How much are we going to get? I have seen estimates anywhere from 11 million to 26 million. Just to give you some context, in 2019, the Department of Community Services and all of our homeless prevention partners out in the community together administered $1.4 million in rental assistance. It's an enormous amount of money to get out the door by September when you're talking about household by household. So you're talking about collecting income information, a copy of the lease, who's the landlord, who's the check made out to, all of that household by household information has to be collected to get, and 65% of 25 million, I can't do the math in my head, but it's still a very big number. I mean, we're probably talking about $15 million by September. We don't know when the funds will be available. The legislation says the allocation and amounts have to be announced within 30 days of passage, but that we don't know if it'll be like CRF, where Treasury just will deposit it into our account and then it'll become available, or if it will be a different process. We don't know how priorities will be mandated. We don't know what specific documentation will be needed. If folks can self-attest, that's a whole lot easier, because basically they just sort of say under threat of prosecution, basically, here's what I made, and I'm attesting to the fact that I'm below 80% of median. Big question is households that we've previously assisted, can we assist them again? I'm seeing some things that say, no, you can't. That's not how the non-duplication of regulations within federal regulations work. Those regulations say you can't duplicate. If somebody got help with April rent, hopefully we could help them with March rent with these funds. Again, we don't know. We're looking for opportunities to partner with other entities. The state developed a portal for their rent assistance program back in September. We were hoping with our other funds to be able to piggyback on that. We weren't able to. So should we be looking at opportunities to partner for some sort of robust web portal for folks to apply? And then, when will Treasury release further guidance? So there's a tremendous amount we don't know. I am starting conversations with the agencies that we have partnered with on all of our other rental assistance programs to say, hey, is there a way that we can all, can we all ramp up a little bit and get this done? It's very exciting. It's a tremendous opportunity. It's a little bit daunting. So I will be keeping everyone posted on, what we know as soon as we know it.
Questions from the.
Thanks, Chairwoman. Will they be giving these funds like in arrears for people that have
What the legislation says that you can help with, I think, up to 18 months of arrearage and up to 12 months forward, but that 12-month forward is only 3 months at a time.
Okay.
So if
Thank
somebody
you.
came to us in February and hadn't paid their rent since June, we could help them with that. And then we could help them
3 months.
for 3 months ahead, and then they'd have to recertify. And obviously that recertification only works if funds continue to be available.
I think we all have a lot of questions here. I did see Member Selman, but then we're gonna have to cut it off, I think.
Maybe you can put it.
Member Selman?
Yeah, just quickly, do we know yet what the impacts will be on the eviction issue? So if we're helping someone in arrears, but they currently have eviction stuff waiting, can we think about a way that we can help get them out of the eviction issue? I know you don't have an answer to that today, but that can just be something that's in our minds.
We are helping currently with folks who have a pending eviction. We are reaching out with anyone with a pending eviction case, at both where we have contact information for the landlord and or the tenant, and letting them know if it's a COVID related impact that we may be able to assist them. So there are folks that we have assisted, and then the eviction case is dropped because if it's for non-payment of rent, you know,
Oh, they're paid, yeah.
Yeah, right.
Great. And then my second sort of more comment was, as we're talking about the need to get these dollars out really quickly by the federal regulations, I'm wondering if there's an opportunity to partner with all the organizations that were members of the Census Complete Count Committee, because that was such a wide variety of all sorts of different organizations. And I think that those would be our most vulnerable populations that might not know they can go to help or find help somewhere. So I wonder if they can help us with the marketing end of this so that people know, once we know what we can do with the dollars, that they're there for
Right,
help.
yeah, absolutely. The outreach we need to make sure we're getting to those heavily impacted communities. The challenge is which organizations have the capacity to actually administer these funds.
Absolutely. All right. Thank you so much for all these updates, Mary.
Sure.
Thank you, Mary. Tip of the iceberg, no doubt. We will continue this conversation, probably many, many more meetings. Thank you. For all of you, any old business, any new business? And before we need a roll call to adjourn, do I have a motion?
So moved.
Second? Let's do our roll call here.
And the second was,
Oh, second, Selman.
okay, thank you.
Member Selman.
Member Swarzy,
Aye.
Member Selman,
Aye.
Member Chaplin, Member Desart, Member LaPlante,
Aye.
Chair Renahan.
Aye. All right, thank you all, and be safe, and I look forward to working with all of you.